It is the most common allergic reaction in the United States, poison ivy. Today on Health Minute, presented by Hallmark Health, we're going to get some tips on how to treat and possibly prevent this itchy inconvenience. I'm here with Sara Breglio, physician assistant at Hallmark Health Urgent Care, and we're going to talk about poison ivy today. I don't know much about poison ivy except that it's a nice green leafy vine or of some sort in the backyard. What is it exactly about poison ivy that makes people so allergic?
So poison ivy is an allergic contact dermatitis. Basically, the oils or the compound in the plant, when they touch your skin, that causes an allergic response. Some sources say anywhere from 50 to 70% of people are affected by poison ivy if they come in contact with it. Other sources, and probably more likely, say up to 80 to 90% of people are actually affected by it.
If someone gets it, but they're not sure if they have it, what are some things they should look for as far as poison ivy?
So poison ivy usually shows up as a red, usually linear rash. Oftentimes it will have blisters or vesicles, which sometimes, but not always, can leak like a yellowish fluid. I would say usually poison ivy is something that people can treat successfully at their own homes. There's a lot of over-the-counter things they can use. Sometimes just a cool compress is helpful. Other times you need like a topical steroid like hydrocortisone, or even just something like a Benadryl cream. If you notice that the rash is covering a large part of your body, especially the face or the genitals, you should seek medical attention. Anytime that the over-the-counter things, like the things I already mentioned, aren't doing the trick, sometimes it will require some either prescription strength topical steroids or prescription strength oral steroids. The other thing, most importantly, that you want to look for is if there's any involvement of the face, the mouth, or around the eyes, if there's a lot of swelling.
Is it contagious?
The fluid that comes from the vesicles or the blisters, if that comes in contact with another part of your body, or if from me to you, that is not contagious. If you have the oils on your skin and something in the oils on your skin touch another person directly from the plant, then yes. So oftentimes people will say that they got it from their dog. That's very true. If the dog's out running in the yard and then you pet the dog and the dog has the actual oils on the skin, that is definitely something that can cause the allergic response. Even just taking them inside, giving them a good scrub. Make sure you're wearing gloves while you're doing it, but obviously we don't want to not be giving our pets the attention they deserve. But no, just washing them off just like you were to wash yourself off if you knew you came in contact with it. Soap and water, and a lot of water to get it nice and rinsed.
Okay, cool. What about children?
Same typical treatment. Again, we stress using the over-the-counter things first. Obviously, whenever we can avoid something strong like a steroid, we try to do that. So hydrocortisone is a steroid cream, but kind of not the prescription strength. So we would tend to lean towards, especially in kids, the over-the-counter, milder treatment methods.
Well, thank you so much for joining us today. This was helpful information.
It's my pleasure.
All right.